Hi everyone, my name is CKElmer, and today I will be presenting my applied research project in partial fulfillment of the requirements of the degree Doctor of Athletic Training. I would like to thank Dr. McLeod for her help and guidance throughout this applied research project, as well as the Doctor of Athletic Training program. This ARP was a critically appraised topic where cognitive behavioral therapy techniques are investigated as a treatment technique to reduce symptom duration in the child and adolescent population who have sustained a mild traumatic brain injury. Mild traumatic brain injuries, also known as concussions, are caused from biomechanical changes of the body affecting the brain. These changes can occur following a direct blow to the head or body that result in a force which is diffused to the brain. These symptoms can rapidly occur following a blow, but often resolve within a short period of time. However, some symptoms worsen over the following minutes and up to a few hours. Typically, symptoms are short-lived, although about 10 to 15% of patients may experience symptoms that are prolonged. Further, it has been acknowledged that adults recover and return to their sport within 10 to 14 days following the initial injury, whereas children and adolescents may take up to 4 weeks to return. Persistent symptoms were identified as the inability to experience normal recovery and dissipated symptoms that are greater than 10 to 14 days in adults and greater than 4 weeks for children and adolescents. Current pediatric concussion management includes daily symptom monitoring and return-to-learn protocols prior to their return to sport. In patients with persisting symptoms, it is important to determine the patient's clinical profiles and tailor treatment strategies to the primary and secondary symptom reports and impairment characteristics of that profile. For example, treatment suggestions for persistent symptoms include an individualized aerobic exercise program for all patients, physical therapy for the cervicogenic profile, and vestibular rehabilitation for vestibular dysfunctions. Additionally, cognitive behavioral therapy is suggested for patients presenting with cognitive or mood and anxiety disorder concussion profiles. Cognitive behavioral therapy, or CBT, is a form of psychotherapy that has been notably researched as a treatment intervention for a multitude of disorders and conditions, and has been used as a treatment method for persistent concussion symptoms. The objective of this treatment intervention is to decrease the symptoms that are associated with these disorders by offering alternative strategies, and in concussions could be used to substitute things like chronic pain. Therefore, the purpose of this critically appraised topic was to determine the relationship between the use of CBT therapy and its effect on persistent symptoms in the children and adolescent population who were diagnosed with concussions. A PICO format was used to guide the search of the literature. Our patient population was identified as children and adolescents who have sustained a mild traumatic brain injury, where the use of cognitive behavioral therapy techniques were compared to usual care to determine if a reduction of symptom duration was seen. The literature was searched using the Boolean search strategy on multiple platforms such as PubMed, CINAHL, Medline, SportDiscus, and the Cochrane Library. Studies were included if they were of Level 3 evidence or higher. The studies were also limited to the English language and to the last 10 years, from 2010 to 2020. Additionally, studies that include the adolescent and child populations who have sustained a mild traumatic brain injury and investigate the use of CBT therapy, as well as studies that investigate CBT therapy compared to other therapy techniques, were also included within this study. Studies were excluded if they did not evaluate the child and adolescent population and did not specifically evaluate CBT. After the literature was searched, 68 articles were returned. 3 relevant studies were included within this study, which can be seen here in Table 1. All 3 studies investigated the effectiveness of CBT on symptom reduction and reported positive improvements. One study by Kurowski et al. Evaluated the satisfaction and feasibility of the self-monitoring activity restriction and relaxation training, or the SMART, web-based program. One study by McCarty et al. Reported positive results when CBT used in combination with psychopharmacological treatments. Another study by McNally et al. Reported improvements in symptoms, functional outcomes, and patient-reported quality of life. There is moderate evidence to support the use of CBT as a treatment intervention to reduce complaints of persistent concussion symptoms in the child and adolescent population. Treatments using CBT have been prescribed for a multitude of diagnoses. Some examples include, but are not limited to, things like depression, anxiety, PTSD, eating disorders, obsessive-compulsive disorder, and chronic pain. While most reports of the use of CBT as an intervention remain positive, all studies did not specifically look at CBT as a singular treatment method. In one case, a multimodal approach was taken where CBT was combined with other psychopharmacological interventions, and in others with predisposing risk factors and additional diagnoses being treated. Based on research findings, CBT can be an effective and reasonable intervention when aiming to decrease persistent complaints of concussion symptoms. There is grade B evidence that exists that CBT, when used as a treatment technique for persistent concussive symptoms in the child and adolescent population, is more effective than usual care. The studies in this CAT noted positive outcomes in using CBT intervention as a concussion treatment technique. Specifically, improvement of symptoms were seen in all 3 studies, as well as increases in aspects such as overall quality of life and functional outcomes. While CBT treats a variety of conditions, it also helps to reduce symptoms of chronic pain, which can occur due to a concussive episode. Specifically, Amal et al. Found CBT may be more effective in treatment of concussions when used as an intervention for persistent complaints of concussion symptoms versus acute symptoms. CBT is characterized into different educational techniques to change their maladaptive behaviors that hinder the ability to fully recover, and the main outcomes of CBT is to alter these negative behaviors and thought patterns associated with the perceptions of concussion symptoms and restructure the current emotions and stress by strengthening positive new beliefs. CBT uses educational models, which were all slightly different in the 3 studies included. These modules included things like symptom monitoring, self-care, positive thoughts, positive thinking, stress management, sleep hygiene, and relaxation and imagery. There have been previous studies investigating the collaboration of athletic trainers and other healthcare professionals. These have included things like a collaborative approach to care that includes personnel such as school nurses and administrators. An example can be seen in McNally et al., where therapists are used to help to develop treatment goals, much like goals are made to accommodate for academics. Additionally, the treatment team for McCarty et al. Incorporated PhD-level psychologists, a consulting psychiatrist, and a primary care physician. These positive and effective relationships and team approach to treatment could suggest the potential for athletic trainers to become a part of the treatment team for persistent concussion symptoms where CBT is used as an intervention. Future research could aim to focus on developing the best treatment approach for persistent concussion symptoms. Additionally, A specific CBT protocol could be made to aim at eliminating and decreasing the duration of concussion symptoms. An example of what this treatment could look like in a youth athletics setting is seen in the diagram created by McCarty et al. In another publishing. CBT was used as a multimodal approach in some cases, coupled with medication and talk therapies. Therefore, future research could focus on combinations of treatments and their effectiveness when combined. This critically appraised topic should be reviewed in 2 years or when additional best evidence becomes available to update these recommendations.